Hello guys, welcome back to Clinically Clear. Today we'll be covering a very short topic, that is IDSP, also known as which is basically Integrated Disease Surveillance Project or Program. Same thing, Integrated Disease Surveillance. It was started in the year 2004. It is basically a disease surveillance system throughout our country basically every part of our country, how many cases are there, basically surveillance throughout the country. It is decentralized. It is not done only by the central government, but like it is divided into district level, state level, etc., done throughout the country for disease surveillance. Now IDSP is transitioning into something known as CBHI, that is Central Bureau of Health Investigation, but it is still going on. Currently we are still in IDSP. So why is it known as integrated? Integrated because it incorporates it through surveillance. It receives data, right? It gets data not just from urban settings, both urban and rural, from private sector as well as public sector, and also regarding communicable as well as non-communicable diseases. Example, let's look at some of the data reporting units. Rural, urban, public sector, private sector. Rural public sector, what do you have? You have PHCs, CHCs, the district government hospitals, etc. Rural private sectors, not many, but you can have certain sentinel hospitals, certain private practitioners in rural areas. Sentinel is when you have hospitals which have a large amount of data. They collect a lot of data, and so they can report a lot of data to the IDSP program. Urban public sector, you have government medical colleges in cities, you have ESI hospitals, you have urban government hospitals, etc. And you also have urban private sector, which is basically the private sentinel hospitals, the nursing homes, the laboratories in cities, the NGOs, the private medical colleges. These are all the data reporting units in private urban sector. So this is about the data reporting units. So this is why it is known as integrated disease surveillance, because it is integrating rural, public, communicable, non-communicable diseases in both public sector and private sector to get an overall idea of the prevalence of diseases in our country. Next, coming to the targets of this IDSP program. First of all, it is a disease surveillance system. So we want to have a decentralized disease surveillance system in our country. Through this program, we can identify certain early warning signals of impending outbreaks. If any disease is going to, if there's any upcoming, like soon, any outbreak of any disease, you can detect early warning signals that okay, this disease is going to spread like anything in the next few months. Based on through this disease surveillance project, we can also study the disease patterns from the data obtained. We can study the disease pattern, we can identify new emerging diseases, etc. And because we receive data regarding all diseases, we can monitor the progress of other ongoing disease control programs. You have so many programs: National Leprosy Eradication Program, National Tuberculosis Elimination Program, you have National Polio Program, you have so many programs, National Vector-Borne Disease Control Program. To monitor the progress of these diseases, you need the data, right? So this data is obtained through this IDSP, Integrated Disease Surveillance Project. How do we do the surveillances? Basically, there are three main methods of surveillance: SPL. S is for syndromic surveillance, P is for probable case surveillance or presumptive surveillance, and L is for laboratory surveillance. Now, who does the syndromic surveillance? Any healthcare worker, even a paramedical worker, anyone can do it. Probable case surveillance is done by a medical officer or a doctor. Doctor does probable case surveillance. Laboratory surveillance is done by a lab technician. Syndromic surveillance is purely based on the signs and the symptoms of the patient. So here, just based on the signs or symptom, you are suspecting a disease. So it comes as suspected case. So the case is classified as a suspected case. Example, you have 6 syndromes. A syndrome, the fever with or without localized sign. This is a syndrome which you can suspect Japanese encephalitis, dengue, malaria, measles. Then cough, you can suspect TB. Diarrhea, you can suspect cholera. acute flaccid paralysis, you can suspect polio, unusual death because of with some skin lesions, etc. You can suspect anthrax, plague, where you'll see bubo. Then you can see if the syndrome is jaundice, it can be yellow fever, it can be leptospirosis, it can be hepatitis, it can be malaria. So just purely based on one syndrome, you're suspecting a disease. That is syndromic surveillance. Probable case surveillance is done by a doctor based on history and clinical examination. You're taking a thorough history, you're doing an accurate clinical examination, and based on that, okay, most probably it is malaria, most probably it is hepatitis. That is probable case. So the case is classified as a probable case. Whereas laboratory surveillance, it is done by a lab technician based on what? A positive lab result. So this is a confirmed case because you have confirmed that this is malaria. You've done a lab diagnostic test. You've gotten a report that this is malaria, so it is a confirmed case. So this is a gold standard of surveillance because it is giving you the most accurate data. But all three methods of surveillance is used in IDSP: syndromic surveillance, probable case surveillance, and laboratory surveillance. Now, IDSP is not the same as IHIP. IHIP is something known as Integrated Health Information Program. This is basically a digital system where all the health records, all the health information regarding our country is uploaded. So it is not anything to do with disease surveillance, but just a digitalized health record system of our country, that is Integrated Health Information Program. Now, what is the significance of this IDSP? This surveillance I told you is done every fortnightly. It is done every 14 days. It is done fortnightly. Every 14 days this surveillance is done. The data is submitted to the government in the form of a disease alert. Basically, every month the IDSP through the National Health Mission, it provides the report, a disease alert to the government saying that okay, this so and so disease is cropping up in so and so places. So this is the importance of IDSP. That's it for IDSP short video. I hope you guys enjoyed it. Thank you for watching.